Unfortunately, thousands of women are experiencing severe complications following their surgeries to treat pelvic organ prolapse and stress urinary incontinence. Our law firm is helping these women hold the manufacturer accountable for this surgical mesh product, responsible for the complications that they're experiencing after their procedure. Pelvic mesh, also known as transvaginal mesh or vaginal mesh, is a synthetic surgical material used to provide additional support and reinforcement for internal organs and tissues. The Food and Drug Administration approved pelvic mesh products in 2001 to relieve symptoms of both pelvic organ prolapse, which occurs when a woman's pelvic floor collapses, and stress urinary incontinence. In July of 2011, the FDA released a stern warning about vaginal mesh, stating that complications were not rare and that it was unclear whether or not pelvic organ prolapse repair with vaginal mesh was more effective than traditional non-mesh repair. They went on to warn doctors to be aware of the risks and to inform patients about the potential for serious complications, some of which may be irreversible. An FDA subcommittee meeting in September of 2011 seconded these concerns and recommended that all manufacturers of vaginal mesh conduct additional studies to clear up safety issues. Pelvic mesh devices can lead to severe complications that mirror the very problems the systems are designed to correct. One of the most common of the many vaginal mesh complications is vaginal mesh erosion. This occurs when the mesh fails to remain in place and instead works its way through the vaginal wall, eroding skin and tissues. Women who experience erosion often suffer pain, bleeding, and painful sexual intercourse, sometimes leading to an inability to engage in sexual intercourse at all. Men may also experience irritation and pain to the penis during sexual intercourse. Women who have experienced these complications may require additional surgical repairs to attempt to remove the mesh. But the FDA has noted that sometimes even multiple surgeries may not resolve these problems. If you or a loved one has suffered problems following a pelvic mesh surgery, contact our law firm and speak with an attorney that can answer your questions, explain to you what your legal rights may be, and we can also evaluate your claim.